In physical therapy, I think one of the toughest things is to get patients to be compliant with their home exercise programs. People want instant gratification. They want quick fixes. They want flashy manipulations, dry needling, cupping, massages, theragunned, cracks. Whether these things help or not is a whole other topic on its own. I feel like a lot of times as PTs or PT students, you know that strengthening and exercise is good, but sometimes I feel like it can be hard to sell that idea to the patient. Today, I want to share two analogies that I've come across that I think can help with patient compliance. So the first one is called the cup analogy. So imagine yourself as a cup. Throughout your daily life, you will have physical and mental stresses that will slowly fill your cup up. Had a rough day at work, lack of sleep, suddenly running a lot when you're not used to running a lot. All of these things can cause your cup to fill up really fast. And eventually, maybe your cup might just overflow a little bit. At that point, you might experience some symptoms in the form of pain or achiness. Personally, I think this is a great visual for patients. Depending on the patient in front of you, you can modify this analogy as you wish. So if you think that a patient's symptoms are mostly mechanical and it's easily reproducible, you can just focus on the physical aspects of the cup analogy. So you might not need to mention the psychosocial aspects that may also influence the volume of liquid in the cup. For example, if you're treating a patient and you think it's mostly a loading issue, it might just be too much too quick. So if a patient hasn't been running a lot and it's all of a sudden they go on a long run, maybe that could trigger a flare-up in their symptoms. So in this case, you can just say your cup overflowed a little bit because you weren't prepared for all that running. On the other hand, for example, a patient with persistent lower back pain, maybe they have more psychosocial factors that are playing a role. In this case, you might need to emphasize the other factors that may influencing the volume of liquid in the cup, whether that be stress management, sleep, or anxiety, or perhaps even a referral to other medical professionals. After explaining this concept, you can come back and talk about the good news, which is through strengthening and progressive loading, you can increase the size of a cup because the human body is very adaptable. So we can either increase the size of the cup through exercise and strengthening, or decrease some of the content in the cup through behavioral modification and stress management and such. I think this analogy is a great way to stress the importance of strengthening exercise. And by building a bigger cup, you'll be a more resilient and robust human being, and you'll be able to tolerate more stresses in your daily life. Credit of this analogy goes to Lehman, and I'll put a link in the description below. The second analogy that I'm going to talk about is the circle analogy. You're a patient and imagine you're the circle, and all the things that you love to do in life is contained within the circle. Whatever your hobby may be, whether it be rock climbing, biking, gardening, or just walking your dog, everything you do is within the circle. But over time, due to factors such as decreased activity levels, aging, increased stress, your circle might just start to shrink a little bit. And eventually, maybe some of the things that you love to do might just fall outside of the circle. You might be frustrated that you can't lift your grandson anymore due to your back pain, or you might not be able to play golf or rock climb anymore. I think this is great because it connects back to the patient's hobbies and what they're really here for. A lot of times people come to PT because they're unsatisfied with their inability to do the things that they want to do. Like the previous analogy, you can say that the good news is through exercise and strengthening, we can slowly start to grow your circle. Credit to this goes to Meakins, and I'll put links to his socials in the description below. I think these analogies provide a very positive view of the human body. Hey, the patient may absolutely have some structural abnormalities, but we can always work with them and build up. And not only is this a positive message, but I also think that this is a good way to build patient self-efficacy because both of these approaches are very active in nature. Compared to passive treatments such as modalities, massage, manipulations, cracks, cupping, dry needling, and all that stuff, this is more of an active treatment where you're getting the patients to take control of their own lives. You as the clinician are not doing something to fix the problem. More so you are cheering for the patient and walking along with the patient. And also I think relating their exercises to their goals will really help with compliance because that's the real reason why they're at PT. You can also use pen and paper or a whiteboard to actually illustrate, draw this analogy, draw a circle or draw a cup. And hopefully this will help the patient to understand it even better. Anyway, if you have any questions, let me know. And as always, if you found this helpful, feel free to like and subscribe, and there's more to come.